Everyday, simple lifestyle choices exacerbate lymphedema for thousands unknowingly. Find out what these are and how easily you can avoid them. And we've got a surprising treatment option as our #1 pick that you wouldn't want to miss. Omega-3 fatty acid supplements. Omega-3 fatty acids are renowned for their anti-inflammatory properties, making them a critical component in the management of lymphedema. These essential nutrients, found predominantly in fish oil, flax seeds, and walnuts, helps reduce the inflammation associated with lymphedema, thereby decreasing the swelling and discomfort that patients often experience. A pivotal study published in the Journal of Nutritional Biochemistry illustrates that omega-3 fatty acids can significantly modulate the inflammatory response in the body, making them beneficial for lymphedema patients who suffer from chronic inflammation and swelling. Incorporating omega-3 supplements into the diet can improve the lymphatic system's function. The fatty acids assist in the fluid dynamics, helping to maintain a healthy lymphatic flow and prevent the buildup of lymph fluid in the tissues, which is a common issue for lymphedema sufferers. Healthcare professionals often recommend these supplements as part of a holistic treatment approach, emphasizing their effectiveness and the minimal side effects associated with their use. Cut out inflammatory oils. Certain oils in the diet are known to exacerbate inflammation, posing significant issues for individuals with lymphedema. Commonly used oils such as soybean, sunflower, and corn oil contain high levels of omega-6 fatty acids, which, unlike omega-3s, can promote inflammation when consumed in large amounts. The imbalance between omega-6 and omega-3 fatty acids in the Western diet is a contributing factor to increased inflammatory responses, affecting lymphedema by worsening the swelling and pain. Replacing these inflammatory oils with healthier alternatives is crucial. Oils rich in omega-3s like flaxseed oil, as well as those with a better balance of omega-6 to omega-3, like olive oil, can significantly reduce the inflammatory impact. These changes not only benefit lymphatic health, but also contribute to overall wellness. Patients have reported reduced swelling and improved limb function after making these dietary adjustments, supported by the recommendations of nutrition experts. Cut out inflammatory foods. The diet plays a central role in the management of lymphedema, with certain foods known to trigger or worsen inflammation. Processed foods, high in salt and sugar, along with red meats and dairy, can exacerbate the symptoms of lymphedema by promoting inflammatory processes in the body. This inflammation can lead to increased swelling and discomfort, which is detrimental to lymphedema management. Instead, adopting a diet rich in fruits, vegetables, whole grains, and lean proteins can help manage and reduce lymphedema symptoms. These foods contain anti-inflammatory compounds that support the reduction of swelling and aid in the maintenance of a healthy lymphatic flow. Health professionals encourage lymphedema patients to focus on anti-inflammatory foods, as consistent dietary changes have shown promising results in reducing the severity of symptoms and improving quality of life. Lymphatic drainage massage. Lymphatic drainage massage is a therapeutic massage technique that enhances the circulation of lymph fluids around the body. This technique specifically targets the lymphatic system, which is crucial in removing waste and toxins from bodily tissues. For individuals suffering from lymphedema, where the lymphatic system is compromised, this type of massage can help reduce the swelling by encouraging the lymph fluid to move towards areas with normal lymphatic drainage. The process involves gentle, rhythmic strokes and pumping movements toward the direction of the lymph nodes. The benefits of lymphatic drainage massage for lymphedema are well documented. According to a study published in the Journal of Physiotherapy, patients with lymphedema saw significant improvements in reduced volume and pain after regular drainage massage. This form of massage not only reduces but also alleviates discomfort and promotes relaxation, particularly beneficial for those dealing with chronic symptoms of lymphedema. Try a lymphedema pump. A lymphedema pump, also known as a pneumatic compression device, is another therapeutic option for managing lymphedema. This device uses air pressure to promote lymph fluid circulation by applying gentle pressure to the affected limb through a sleeve that inflates and deflates at regular intervals. This action mimics the natural pumping mechanism of the lymphatic system, helping to remove excess lymph fluid back into the circulatory system and thereby reducing swelling. The lymphedema pump is typically recommended for patients who have severe lymphedema or who have not responded well to other treatments. Its use is often advocated in combination with other therapeutic approaches like compression garments or manual lymph drainage to enhance overall efficacy. Medical professionals might suggest the use of a lymphedema pump during the more intensive phase of lymphedema treatment, followed by maintenance phases where the device's use may be reduced. Try lymphedema exercises. Lymphedema exercises are an integral part of managing and alleviating the symptoms of lymphedema. These exercises are tailored specifically to enhance the lymphatic drainage and ensure the effective movement of lymph fluids throughout the body, particularly in areas affected by lymphedema. The essence of these exercises lies in their ability to stimulate the lymphatic system through a series of gentle, rhythmic movements that involve both contracting and relaxing muscle groups. The types of exercises recommended for lymphedema patients include light aerobics that promote general circulation, stretching routines that enhance flexibility, and targeted movements aimed at the limbs most affected by lymphedema. Arm lifts and leg raises, for example, are particularly beneficial for stimulating lymph flow in these areas. These exercises increase lymphatic drainage and can help to reduce the swelling that typically accompanies lymphedema. Regular participation in a structured exercise program has been shown to have significant benefits for lymphedema sufferers. Research documented in the Journal of Physiotherapy highlights that patients who engage in regular lymphedema-specific exercises experience marked improvements in limb function and a noticeable reduction in swelling. Furthermore, these exercises contribute to enhanced overall well-being and quality of life by enabling patients to manage their symptoms effectively. Let fluids flow easily. Ensuring that lymph fluids flow easily is another critical consideration in managing lymphedema. An often overlooked factor in this process is the type of clothing worn by individuals affected by lymphedema. Clothing that is too tight can significantly impede lymphatic circulation, worsening the symptoms associated with the condition. To prevent such issues, it is advised that patients choose garments that are loose-fitting and comfortable, which do not exert unnecessary pressure on the body, especially in areas prone to swelling. For individuals with lymphedema in the arms, for instance, it is important to avoid clothing and accessories that are restrictive around the wrists, such as tight watches, bracelets, or elastic bands. Similarly, for those with lymphedema in the legs, tight socks or shoes should be replaced with options that provide better circulation and comfort. The choice of fabric also plays a role. Breathable materials such as cotton allow for better airflow and help maintain optimal skin health, which is essential for promoting effective lymphatic drainage. The strategic selection of appropriate clothing and accessories is simple yet effective in facilitating the lymphatic flow and reducing the discomfort and swelling associated with lymphedema. By making thoughtful choices in their attire, patients can significantly enhance the effectiveness of other treatments, including exercises and massages aimed at managing lymphedema. Wear compression stockings. Compression stockings play a significant role in the management of lymphedema, especially for patients experiencing lower limb swelling. These specially designed garments apply gentle pressure to the legs, helping to maintain fluid flow and prevent the accumulation of lymph fluid. When choosing the right type of compression stockings, it is essential to consult with a healthcare provider to ensure they are suitable for your specific condition and provide the correct level of compression. The benefits of wearing compression stockings include reduced swelling, alleviation of discomfort, and prevention of further progression of lymphedema. Best practices for using compression stockings involve putting them on before getting out of bed in the morning, when swelling is at its minimum, and wearing them throughout the day. It's also crucial to regularly wash the stockings according to manufacturer instructions to maintain their elasticity and effectiveness. A study published in the Journal of Lymphedema highlights the effectiveness of compression garments in managing lymphedema, showing significant improvement in patients who consistently use them as part of their treatment regimen. See a lymphedema specialist. Consulting with a lymphedema specialist is vital for anyone diagnosed with or at risk of lymphedema. These healthcare professionals specialize in the disorders of the lymphatic system and can provide tailored advice and treatment plans to manage symptoms effectively. A lymphedema specialist will conduct a thorough assessment, which includes reviewing medical history, conducting a physical examination, and possibly using diagnostic imaging to better understand the extent of lymph involvement. During a consultation, patients can expect to discuss various treatment options, including manual lymph drainage, compression therapy, and the necessity of ongoing self-care measures at home. The specialist may also recommend lifestyle modifications, such as diet changes and exercise programs specifically designed to aid lymphatic health. The importance of professional guidance cannot be overstated, as it ensures that treatment is both appropriate and effective, based on the latest clinical evidence and practices. Today, we explored 9 impactful natural treatments for lymphedema. From simple dietary tweaks to the guidance of specialists, these methods are not just theories, but are backed by science and have been effective for many sufferers of lymphedema.